Roleplay. I prepared, we haven't actually prepared it, but that'll be fine. It's okay, I'm about to, so, case one. Wait 1 moment. B, oh sorry, B.
We have a PowerPoint malfunction.
Okay, so I'll read you the case. Karen Wilson is a 15-month-old girl. That's her, okay. Due to have her MMR and HIV vaccination tomorrow afternoon. Her mum, Mrs. Wilson, comes into the pharmacy and asks for advice regarding Karen's vaccinations.
Hi,
Hi, how can I help?
Hi. This is Karen. She's 15 months old, and she's going to get her MMR and influenza vaccine tomorrow.
Okay.
She's had a bit of a cold for the last 2 days.
Okay.
No fever.
No fever?
Normal.
So it's just quite mild?
Yeah.
Okay. Okay, so you're inquiring about the vaccinations for Karen?
Yes.
Okay, well firstly the New Zealand immunisation schedule recommends 3 vaccinations for a 15-month-old child. One is for just basically flu, one is for, it's called MMR, it's measles, mumps and rubella, and one is pneumococcal. Have you heard anything about these?
Just the MMR and the flu.
Anything in particular?
Oh yeah, about what's her risk of autism? I'm quite scared, so I'm thinking of just asking the GP to give her just a single injection, so separately, not together.
Okay. There have been trials on that, and there's no strong evidence to suggest that the MMR vaccination is linked to autism. Some of the concern might just be raised around the fact that autism shows up at the same time a child gets the MMR vaccination, so they're not actually linked as such. So my advice would be that she gets all 3 vaccinations, and that if you like, you can give her some paracetamol before she gets the shots to help with the pain.
How much do I give her?
What's her weight?
She's about 8 kgs.
I like get my calculator out and do 15 times 8. 8. How much does a 15-month-old weigh? Anyway, the instructions are here on this label that's printed by our pharmacy, which we place on the box. And anyway, I worked that out. So you can give that before the shots, or if you would prefer just after, if you notice that she's looking a bit unhappy, a bit grizzly, something like that. Some common side effects are redness around the injection site. Many people get a fever following an injection. Following an immunisation, and those things are all completely normal, but they can show up to 12 days after the shot, so just be aware that if maybe she got a bit of a fever in a couple of days' time, it still could be linked to the injection. And all these are completely normal, but go back and see your doctor if they get worse or they don't resolve. Yeah, and it's fine to give her the immunisations with the mild cold that she's got. What about yourself?
Well, I have not had rubella vaccination. Can I get it as well?
Usually we would recommend that you get a vaccination for rubella sort of when you're planning the pregnancy, and that's just because there's some risks posed to the fetus in the first trimester. But since I think you're a bit beyond the first trimester, don't worry about it too much now. But if you like, you can get the vaccine after you've had the baby. But there's no benefit really in getting it right now. In fact, for live vaccines, which is rubella, it's not recommended in pregnant women.
Okay.
But don't be worried that you didn't get it. It's probably okay.
Okay. And what about this one?
Your unborn child? There are a few things that are recommended for the child to receive at birth. But these are for babies who are a specific risk for something. So BCG is recommended for babies who are at a high risk of TB. It's not common in New Zealand, but your obstetrician or GP would know about that. Also Hep B, again, for people at risk. So if you know yourself that you are a carrier of Hep B or have Hep B, then the baby receive a vaccination for that at birth. The meningococcal vaccine is no longer in a schedule for to be received at birth, and that's because is there not a vaccine for the Hep C for the C yet? No. Yeah, so it's because there's no vaccine to match the strain that we're worried about at the moment. And then at 6 weeks, there's 5 or 6 other ones that the newborn will receive. And just one more slide.
Very good.